Hello. Today we're going to walk through a presentation of the recovery coaches in the emergency department program. The purpose of this presentation is to introduce you to what the program is and what it looks like in the state of Vermont. My name is Vinnie Emery, and I'm the recovery coaches in the emergency department program manager. This is intended to be an introduction to the recovery coaches in the emergency department 2-day training for folks who are considering or have been hired to work in recovery centers program. Recovery coaching in the emergency department aims to serve individuals presenting with substance use disorder in the emergency room by creating relationships between recovery centers and local hospitals and implementing recovery coaching in the emergency department to patients who are presenting with substance use disorder. Recovery Coaches in the Emergency Department program is a program made possible through a grant from the Vermont Department of Health's Alcohol and Drug Abuse Program. The program is managed by Recovery Vermont, which is a subset of Vermont Association for Mental Health and Addiction Recovery. The RCED program in Vermont is just passing its second anniversary. The first 3 sites, which were our pilot programs, launched on July 2nd of 2018 and in August of 2018. And those 3 were the Turning Point Center of Central Vermont and Central Vermont Medical Center, the Turning Point of Chittenden County, and the University of Vermont Medical Center, and the Turning Point Center of Bennington County and Southern Vermont Medical Center. Over the last 2 years, the other recovery centers that you see here and their local hospitals have joined the program. And we are now housed in 10 recovery centers and 12 local hospitals throughout the state, with two of the centers both having 2 hospitals, and that would be the Turning Point Center of Vermont and the Turning Point Center of Springfield. So the expected outcomes of recovery coaching in the emergency department. So these are our goals. These are the things that we want to see happening in our program and the things that we are succeeding in seeing happening in this program. And they are reduced recidivism, which means fewer return visits, reduced substance-related emergency department visits overall, reduced cost in emergency department caseload, reduce opioid overdose risk for individuals, more people entering into long-term recovery, and increased awareness about the hope and healing and the power of recovery for persons struggling with substance use disorder, their family members, and the hospital staff and volunteers. To infuse the hospital system with recovery values and concepts, to increase the connection rate to community care, and to save lives. In your 2-day training to become an emergency department recovery coach, you'll go deeper into what we'll be looking at over the next few slides about what it means to be a recovery coach in the emergency department. If you are watching this presentation and planning on attending the emergency department recovery coach training, you should have already gone through the Recovery Coach Academy, so you're familiar with what a recovery coach is. But we'll take a quick look at it now and I'll talk a little bit about what it means to be an emergency department recovery coach. So a recovery coach is a guide, a mentor, and a listener. They're someone who will support individuals in recovery from substance use disorder. They are often peers, family members, allies, clinicians, anyone who wants to learn and apply evidence-based practices to help others in recovery. They provide resources, tools, encouragement, support, and structure in a wide variety of settings. They use strength-based approach to help their clients find internal motivation that make positive change. And they are knowledgeable about the multiple pathways to recovery and help clients to access those resources and to enter into recovery. So these are some of the qualities that we look for in a recovery coach that's working in the emergency department. Again, this is something we'll go deeper into, but I wanted to take a look at some of the main points here today. And so we want and require that recovery coaches in the emergency department are trauma-informed and trauma-sensitive, that they are non-judgmental and patient, that they're comfortable working in emergency situations, that they work compassionately with a wide variety of people and avoid gossip and mitigate drama, that they can respect hospital protocol, that they be professional and positive representations of their recovery center, and that they have experience with data entry or be able and willing to learn. To that last point, you really should have basic computer skills. There's a lot of data that we do collect. We'll look at that a little bit later. That's required for the by our grantees for this program. So it is a big part of this job. Another thing, and you'll see in this box, the text box here, that I said it's important to note that unlike regular recovery coaching, emergency department recovery coaching is usually opt-out instead of opt-in, which means people choose to not be in it after they've already met a recovery coach before, instead of deciding to go to a recovery coach like they would do at a recovery center. Folks are coming into the hospital in distressing situations and are often in pre-contemplation as well as experiencing trauma, high anxiety, inebriation, pain, and withdrawal. These points are really vital to look at because they speak to the nature of the job and really the environment in which we're working, which by nature, the environment of an emergency department is high stress and a space where trauma happens. A lot of the folks that you will be working with will be experiencing trauma or have experienced trauma, and there might be other traumas going on around you just because the nature of the emergency department. So it's important to look into yourself and see if that is an environment in which you would be comfortable in, and an environment in which you can remain grounded and present in order to best serve the folks that we're seeing coming into the emergency department. Again, we'll go much more into this and at the training, and there'll also be an additional video for you to watch along with this that is about trauma-informed practices and how to care for yourself in those situations. So let's take a look at how a recovery coach supports the emergency department staff. This is really important because it speaks to one of the biggest ways of how we address stigma in the hospital setting. A lot of what we do and a lot of what you'll learn about at the training is advocating by being accountable and professional and showing up and doing your job well. So here it says, a recovery coach working in the emergency department lessens the stress and the workload of the emergency department staff because they are there specifically to connect with the patient, listen to them, make a plan for post-discharge, and get them connected to recovery resources and wraparound services. This frees up the emergency department staff to attend to other patients. A recovery coach is a great resource for hospital staff to understand more about substance use disorder and recovery. Because most recovery coaches are also people in long-term recovery, they are wonderful examples of what recovery can look like, helping to reduce stigma and give hope to the hospital staff that change is possible. A lot of you will experience some pushback at some point or another from staff because of their exposure to trauma and their exposure to folks with substance use disorder. It could be in their own lives and very likely in the emergency department. It can be really hard for someone to remain hopeful when they're working in high stress environments and they're seeing someone come in over and over again for the same thing. So that's why it's really beautiful to have an emergency department recovery coach in there to help take that stress off and be willing to be the one that shows up every time for that person. And that's really what make changes, not just for the patient, but also, as I said earlier, in the stigma and ideas of folks with substance use disorder and what recovery looks like. So let's take a quick walkthrough of a recovery coach visit when they're going to the emergency department. This is, again, this is a slide you'll see at your training, and something I just wanted to touch on beforehand just to give you a visual of, in some context of the program itself. So this is just the program starting from a phone call to the hospital or from the hospital and to when you discharge the participant. So I'm going to talk in general terms. This looks a little bit different at each hospital depending on the agreements with the hospital and the staffing of the program, which often depends on the size of the recovery center and the population. So in rural places and urban places, the program might look a little bit different, but this is a really general idea of what a call might look like. So the first thing to happen is that a patient will come into the emergency department and they present with a substance use disorder. That could be through an overdose or alcohol poisoning or an accident, or it could be through some screening that they are flagged. And so at that point, the emergency department will page recovery coach. In most places, there's agreement that it's within a half hour that the recovery coach arrives at the hospital from when they get the page. Often when they get the page, they'll have a brief conversation on the phone with the hospital representative making the call. Often that's like the charge nurse. And so you'll get a little bit of information there, and then when you get to the hospital, you get a debrief often from the charge nurse, but again, this looks different at each hospital, and they'll give you what's called the face sheet. A face sheet is a piece of paper that will tell you information about the client. It will give you name, birthday, and a lot of information, and we'll give some information about why they're there, but it's also very useful information to help fill out our intake form later, so we'll revisit that in a minute. So you'll get a chance to check in with them about the patient and look at the information about them, and then they'll introduce you to the peer. And in that introduction, you'll give your brief elevator speech of what a recovery coach is and why you're visiting. And then depending on where the patient is at, meaning if they're conscious or cognizant and they're able to engage in conversation, you are likely able to provide motivational interviewing there. Sometimes that's not possible because of the situation. And so it may be like introducing yourself and leaving some information and asking if you can give them a call tomorrow. But if you can, you engage in conversation with them using motivational interviewing. If it's appropriate, sometimes we work with them and a staff member to get them connected to treatment. And then once you're finished with the client, you'll complete any intake paperwork there at the hospital. That's where you'll use that face sheet that I mentioned earlier. There you'll store your intake in a locked cabinet, and you shred the face sheet before leaving the hospital. They will give you a lot of training on that at your recovery center, and that's an important HIPAA compliant act. So we never bring the face sheet outside of the hospital. That belongs to the hospital, and so they are responsible for keeping that information safe, and that's how we help them do that. With a peer's consent, we follow up with them for at least 10 days or until they ask us to not call them anymore. So we'll give them a call for 10 days, check in, we'll do the motivational interviewing during that time, get them connected to resources that are directly related to recovery and a lot of community resources as well. You'll also receive a lot of training on this at your recovery center and some at the Recovery Coach in the Emergency Department program training as well. But you will have a specific binder with resources and learn about like when to share what resources with them. So we never just leave anyone. We really want to get them connected. And so at the end of the 10 days or however many days you end up working with the person, typically we keep it in a 10-day program because this is a triage program and not an ongoing program. We end with what's called a warm handoff, and that means that we are introducing them to a program and people who can help them longer term. That might be regular recovery coaching, telephone recovery support services, or other recovery and treatment options. So this is just a look at the training that goes on for someone wanting to become a recovery coach in the emergency department program. So you've already done the academy, and then you're getting ready to attend the 2-day recovery coach in the emergency department training program. There's different trainings at each of the hospitals, and that is decided on by the hospital and agreed upon and with your recovery center in the hospital. And so you'll learn more about that directly through your recovery center. You'll do a database training at the recovery center, and you'll do some shadowing. That means you're going into the hospital with other recovery coaches. So you're not just sent out there on your own expected to recovery coach right from the start, but you get a chance to go in with another recovery coach and kind of learn the ropes with them. Ongoing, there's a lot of different trainings offered through us here at Recovery Vermont, including professionalism, ethics and boundaries, trauma-informed practices and trauma stewardship, and other trainings that we might be offering on like race and gender equity, harm reduction practices, and so on. So let's just take a look at some of the data. So this data is not our most recent, that we have some data that's currently being processed, but this is the most recent published data. So this goes from July of 2018 until the end of this past March. As you'll see, the largest number of folks we see, about 62% here, is alcohol-related visits. That has not changed. These numbers that you see here, even though the individual numbers will go up and down, the percentages do not change even as the numbers increase. It pretty much stays at these levels. So the most number of folks, mostly you'll be seeing are folks with alcohol use disorder or and then the second being opiate. It's important to note that we often see folks that have multiple are either at that time using multiple substances or have addictions to multiple substances, but the ones that we count are the ones that are most presenting at that time of the emergency department visit. There's a little note here that as we look at the data, the sites that we look at have all rolled out within a 2-year period. So a lot of the numbers the big differences in a lot of the numbers, and you'll see that on the next slide. So here's just some of the demographics. That's pretty reflective of what our state looks like as far as race and ethnicity, where our state has 98%, at the last census anyway, is 98% white presenting or white identifying people. And the largest numbers that we see are folks who are between the ages of 25 and 44, but certainly large numbers in all of the areas. And these are the number of unique visits that have been seen within 20 months at each of the hospitals. Well, at the first 3 hospitals, and then the bottom we have 1 month, less than 1 month at Porter, so they only have 6, and those numbers will continue to increase, but that's what I was speaking about with the difference of numbers. And another thing that's important to mention is that we make a big part of our job is making resource referrals. So we don't make direct referrals, but we recommend resources to a lot of different places, direct recovery, direct treatment, and a lot of mental health and community resources as well. It's a huge part of what we do and that's largely part of us being a triage program, is that we're really trying to get them connected to the community, connected to treatment, and sometimes before, especially because we're meeting people who are often in pre-contemplation, there's a lot of reasons why they're in pre-contemplation, and that's because they have a lot of other unmet needs such as housing or food insecurity or whatnot, and so we try to help address those issues so that they can meet them and then maybe think about getting into recovery once they're stable in those other places in their life. And so that is the end of my presentation today. Thanks for listening. We're very excited to have you at our training and excited for this opportunity for you to practice recovery coaching in the emergency department. Thank you and take good care.